Welcome back to drsellarseducate. We are thrilled to have you back focusing on Competency 6 for our CNE snapshot. This is going to hone in on three important concepts as it relates to the ability for us as nurse educators to function as change agent and leaders, looking at cultural sensitivity, organizational effectiveness, and visibility in nursing. First, cultural sensitivity. As educators, we must act. We must acknowledge that each individual participating in the change process is unique, being aware of any unconscious and conscious biases that we may bring into the educational landscape, just being considerate and having humility related to the diversity of cultures and needs within our colleagues as well as within our student body. C, collaborate. We want to reach out to our peers, reach out to our colleagues to increase engagement and to role model the cultural sensitivity that we expect to see in others. Teach is what T stands for. So we should be teaching practices that will incorporate some of those components associated with multicultural education to promote educational inequity. We know that each student should be treated as an individual. That is step one in helping us just bring in some of that humility and sensitivity associated with the diverse cultures that we see in our classroom. And think about the diversity of our learners as well. Every student learns differently. We know we talked quite a bit about that in competencies 1 and 2. Second concept is organizational effectiveness. Participation, so taking an interdisciplinary approach when it comes to making changes that happen from a university standpoint, as well as within nursing. Being engaged locally, regionally, nationally, as well as internationally, and looking at how some of those changes are happening. Implementation, so implementing those strategies from an organizational standpoint into our clinical practices. And this we should support translating into our curriculum. There are lots of changes that are going to be happening over the next 10 years as we think about the future of nursing report. 2020 to 2030 is the 10-year time frame we're looking at now. Take a look, if you haven't already, at some of the takeaways that have been identified in that report. It's quite fascinating and, to be transparent, overwhelming for many of our nursing education leaders, as we all should be supporting these changes and really partnering at the university level as well as at the college level to ensure these changes happen. Leadership skills, we have to take responsibility for our learning and our development as nurse educators. So it starts with us doing that self-assessment to identify gaps and then working on a strategy to close those gaps. Visibility. So when we function as nurse leaders and we role model those behaviors, there's a certain number of components we need to consider. First, we have formal roles of leadership, we have informal roles, and then we have the role of leadership from a healthcare partnership standpoint. In order to do that, we have to have a strategy as nurse educators. So reaching out to our leaders within our colleges or schools of nursing to identify a strategy that's going to support success. And we know that starts with the vision and collaboration.